for sure.
No, never.
Well, each and every week we bring you some useful and hopefully helpful health and wellness information in medical rounds. The new legalization of sports betting here in our state is bringing some concern about problem gambling. Channel 3's Nicole Nalepa talked with Dr. Leah Russack-Baker about that.
Thanks for joining us. First things first, when is gambling considered a problem?
Well, let me tell you, sometimes it's a problem before people actually want to name it a problem. But what we know is that people's behavior starts to change. They start planning for gambling. They start now giving up social activities and perhaps even leisure activities that they used to do. And they start having to make up more money for losses. They're starting to also learn, okay, maybe I need to cut back because this is becoming a problem. So it sometimes is not necessarily said specifically that it's a problem, but people start to see that it could be considered a problem with their behavior that they usually are not doing on a daily basis.
So it seems as though you kind of listed some of the causes, but it seems as though it's hard to identify at the same time.
Right, and so sometimes there's some risks. There are people that start to have depression, anxiety, even folks with PTSD, that they're noticing that they're starting to use, say, gambling as a false refuge to regulate some of their symptoms. And so they're not seeing that it's a problem right away, but they're sometimes addressing a mental health issue with gambling as a resolution, but then that now becomes a problem. It's not a refuge of being able to alleviate those symptoms, but it's actually creating more problems. And that sometimes shows up for those people that are also at risk for having gambling problems with those mental health disorders as well.
And one last question before we go. What kind of treatments are available for this?
There's a variety of different treatments available, and I do want to just make sure that I emphasize that this does impact families, and often the families will be the ones to say, look, I think there's a problem here. You know, you're not spending as much time at home, and this is also, there's a gender bias, so let me make sure to let people know that females and males can have this problem with gambling. And there's support groups for the families, and there's treatment for people with gambling problems, and you can see those resources on the DEMAS website, which lists a variety of different support groups, outpatient treatment options. And from a medication standpoint, psychiatrists often are treating the co-disorders. So if there is depression, anxiety, mood disorders, there is medication management that can also help with the gambling.
Now, the doctor is hosting a webinar later on this month on identifying problem gambling. For more information, go to hartfordhealthcare.org/virtual classes.